Hi, I'm Dawn. I support people with learning disabilities to access the care and treatment they need. This can involve a range of professionals, teams and organisations. It's my job to make sure that care is delivered at the right time, in the right place, by the right people. To explain how I do this, I'd like to share Alan's story with you. Alan is a 48-year-old man with severe learning disabilities and autism. He lives in a specialist nursing home. Alan has lots of needs and is very afraid and resistant to daily care activities. He finds any health-related tests unbearable. He has an underactive thyroid which requires medication. This needs to be monitored and adjusted based on blood test results. The community matron supporting him knew it would be impossible to obtain a blood sample. She also knew not having these tests could be harmful to his health, so she contacted a specialist learning disability team for further support and guidance. Alan has a history of eye problems. Care home staff noticed he was bumping into furniture and becoming increasingly disorientated. This led to concerns about his eyesight. Alan's eyes were assessed at home by an eye specialist and then by an eye consultant who came from the hospital to do the assessment on the minibus, where Alan felt most comfortable. Alan wasn't coping very well. His behaviour had changed and he was becoming frustrated with his situation. A specialist team was approached by the care home staff to give guidance on how to manage Alan's changed behaviour. I arranged a best interest meeting to discuss the care and treatment Alan needed and how it could be achieved. This involved consultants, community matron, eye specialists, care home staff, specialist learning disability staff and also Alan's family members who were his advocates. We all agreed Alan should have a general anaesthetic. Whilst he was asleep, his eyes, ears, feet and teeth could all be treated and blood and heart checks could also be undertaken. To do this, I needed to coordinate 17 members of staff from 3 different organisations to provide joined-up care for just one hospital visit. Before Alan went to hospital, I visited him at home to check he was well enough for an anaesthetic. Working closely with hospital staff, we planned what would happen if Alan had any complications and needed to go onto the ward. Special arrangements with hospital security team were made so Alan could go straight to the anaesthetic room, through the fire escape doors to reduce Alan's levels of distress. Admission paperwork was completed on the minibus. Wristbands were not put on, nor did he change into a hospital gown, further reducing causes of distress. Alan was found to have raised pressures in his eyes and required eye drops. Medication did need to be adjusted following his blood results. He had his teeth scaled and polished, his teeth and hands were treated and earwax was removed. The heart check results were clear. Alan's familiar support workers were with him and waiting in the recovery room when he woke up from the anaesthetic. He was discharged from the hospital in the recovery room and supported to go home the same way he had arrived. All of these reasonable adjustments reduced Alan's anxiety so he could receive the care and treatment that he needed. This is an excellent example of quality joined-up care for the benefit of Alan. We think more care should be provided in this way to improve the health and lives of people in our community.